morning. This is a presentation about my PhD topic entitled Iron Deficiency Anemia During Pregnancy, Effects on the Offspring. I am Isabel Amorim. I am a dietitian, and I am currently a first-year PhD student at the Department of Obstetrics and Gynecology. My supervisor is Nandor Ach. My scientific methodology supervisor is Annette Sabo. And I have a vision that pregnancy can have better outcomes through early detection of anemia and implementation of nutritional interventions. My mission is to raise awareness among patients regarding the effects of iron deficiency anemia. These are my current specific goals, so I'm going to talk about these first two. They are two meta-analyses. The first one is investigating the impact of iron deficiency anemia on pregnancy outcomes, a systematic review and meta-analysis. We have an overall prevalence of anemia worldwide of about 37%. However, this range of prevalence is quite big because it is dependent on the economic background. So we have that the developing countries have a higher prevalence of anemia when compared to developed ones. And anemia is a risk factor, a known risk factor for pregnancy outcomes, for example, for low birth weight. And these pregnancy outcomes, they raise the morbidity and the mortality of both the mother and the offspring. Some examples of pregnancy outcomes are preterm birth, which occur in 10% of the women, spontaneous abortions from 15 to 20%, and intrauterine growth restriction, IUGR, from 8 to 10% of the women. We have some controversial data regarding these outcomes. Some studies say that the anemia is a risk factor for these outcomes. Some others say that it's not. So that's why we want to run a meta-analysis on this topic. So our aim is to identify the interrelations between iron deficiency anemia and the pregnancy outcomes. Our clinical question is, does anemia increase the frequency of adverse pregnancy outcomes? Our population is pregnant women. Our risk factor is anemia. Our outcomes of interest are preterm births, spontaneous abortions, IUGR, small for gestational age, and stillbirth. We hypothesize that anemic pregnant women have a greater risk of having adverse pregnancy outcomes. Our clinical implication is to decrease the adverse pregnancy outcomes by identifying women at risk and having the right implementation of nutritional interventions. We have conducted systematic research. We have 3 databases, and our search key is divided in 3 main domains. So we have the population and the condition of anemia and the pregnancy outcomes. This is the flowchart of selection. So this search yielded more than 20,000 citations, and we have a final number of 212 full texts to include in the data extraction. So this is our first project progress. We have a feasible topic. We have run all of these phases. And currently, we are extracting data of these selected articles. The second topic is investigating the impact of iron deficiency anemia on congenital anomalies, a systematic review and meta-analysis. We have that congenital anomalies, they affect approximately 3 to 6% of the offspring, according to CDC. And they are divided into major and minor congenital anomalies. So for example, the major ones, they are life-threatening. And for example, we have neurotube defects, congenital heart defect as well. And the minor ones, absent nails and undescended testes. In 2010, we had more than 270,000 deaths due to these congenital anomalies. However, we have many strategies for prevention. For example, prevention for STIs, management of chemicals, avoidance of embryotoxic medications intake, vaccination against rubella, and fortification with micronutrients. This micronutrients intake, they show to be effective in decreasing neurotube defects. And we also have clear data that folate deficiency anemia and the correct supplementation lead to better outcomes in this population. However, we still lack the literature on other micronutrients and the analysis of the isolated anemia, for example, iron deficiency anemia. So our aim is to identify the interrelations between iron deficiency anemia and the congenital anomalies. Our clinical question is, does anemia increase the frequency of developing congenital anomalies? Our population of interest is pregnant women at the first trimester. Since the congenital anomalies, they will develop until the first trimester. Our risk factor is anemia, and our outcome is the congenital anomalies, the major ones. Our hypothesis is that anemic pregnant women have a greater risk of having major congenital anomalies when compared to the non-anemic ones. Our clinical implication is to decrease the frequency of major congenital anomalies by identifying women at risk and implementing the correct nutritional interventions. We have a preliminary research, so this preliminary research has yielded over almost 3,000 citations, and it is divided in 3 domains: population, the condition, and the outcomes. In summary, we have 2 ongoing projects. We plan to submit the first paper in May 2023 and the second one in July 2023. I would like to thank you for your attention and finish my presentation with a quote of R. Spa. It is not enough to be at the right place at the right time. You should also have an open mind at the right time. Thank you very much.
Jakub Ferica, Gastro Group. Thank you for the impressive presentation. I would like to ask if you are planning to take to account the causes of the anemia.
This is not the focus. This is not the focus yet of our project. So far, we have just analyzed the presence of anemia and the risk of developing the pregnancy outcomes. However, we saw many papers in this search key that they were analyzing the risk factors of developing anemia during the pregnancy or prior to the pregnancy. However, this is not our focus yet. The next projects they will focus also on the supplementation. But some reasons are, for example, vegetarian diet, or just like I said before, the economic background is very poor, and these are some risk factors, but we are not focusing on them yet. Thank you for your question.
So congratulations also on your presentation. I would have 2 questions. First one is regarding your PFO framework. So for F, I saw that there is anemia, and I would be curious if it's really like only iron deficiency anemia in those 200 articles that you have. So that would be the first question, or also you account for the different types of anemia. And the second one, when it comes to your articles as well, I also work on my meta-analysis. I found that there were, for example, different geographical location of the studies that I have right now. So how it is for your study? Do you have do you have studies from all around the world or mostly from some regions? Thank you very much.
Thank you for your question. Regarding the first one, we are only evaluating iron deficiency anemia. So we have excluded, for example, the hemoglobinopathies, so thalassemia and other kinds, also sickle cell disease. They were all excluded. We are only evaluating the iron deficiency one. And regarding the second one, we have many articles from many places. And we are talking with a statistician about the possibility of evaluating also the prevalence of anemia according to these different regions. And, but our search key is not giving this prevalence data, so we are not going to analyze the prevalence in this topic. But certainly we are going to run many subgroup analyses and see if there is a difference also between these different regions. Thank you for your question.
Yeah, it looks like that you actually get a very, I would say, popular area since you have so many papers. Are there meta-analyses already published? And if so, then what is going to be the addition in your present one?
Yeah, there is a meta-analysis already on the topic. However, they analyzed only 2 outcomes of interest that we are evaluating here. So. And they also evaluated low birth weight and found a significant effect, but we are not evaluating them since it is already proven. And the difference would be that it would be more updated, so there were many papers published in 2022, and we want to take them into account. And the previous meta-analysis, the last search was in November 2018, and there is still many data to analyze, I think, and there's going to be a strong point compared to the previous one.